Got it.
Okay, here we go. Our update. So the good news in Colorado is that have seen a significant decrease in cases. We had our peak after the Thanksgiving surge, and then we are on our way back down again. Of course, we are all holding our breath to see what has happened with Christmas and those gatherings, and of course New Year's. But for today, things look pretty good. So we're going to celebrate today.
Absolutely.
Our positivity rate also in Colorado is decreased similarly to the number of cases, and so you can see the red line is taking a dive. The 2-week cumulative incident rate is still not great, but I guess it's hard to get worse than greater than 100, but it's definitely not changed much from last week. Hospitalizations are also fortunately decreasing in Colorado, which is great news. When we have that surge capacity to be able to handle folks who get sick, it definitely makes us all feel better. If unfortunately we have to continue to worry about bed availability, that is a drag. But today, again, things look good. So hopefully that trend will continue. Deaths are also decreasing. It's, I think, important to take a pause here and just look at this curve. If you look at, what we did in the spring, which, was horrific at that time, looking at what's happened recently, is very terrible as well. And I think that there's lots of things that I've seen on social media talking about how we don't have to worry about the death rate anymore. Well, it's not true. Certainly in Colorado, it is definitely prevalent. Our data, again, continues to mirror the state. So we have our cluster of cases here, but we are also decreasing after Thanksgiving. And again, all holding our breath. I'm waiting to see what's going to happen with Christmas. But for now and today, things are good. Our positivity rate continues to hover here around the 10 to 12%. There was a little bump this past week, so we'll continue to follow that trend. Our cumulative cases, if you can imagine, maybe with your eyes closed, there's a little flattening of our curve here. And certainly anytime we see a decrease in the slope of that overall curve, boy, that's just encouraging. Our hospitalizations, we are doing well here at St. Vincent Health. We continue to accept our COVID patients. We are keeping our locals here as best we can. There are some days where we have more, some days where we have less. We are also helping our neighbors with their surge capacity and taking patients who don't have significant cardiorespiratory conditions. And so we can certainly, help the hospitals that surround us make their beds more available. And so that plan is working well, and St. Vincent's continues to enjoy inpatients. Our summary slide, there are 31 positive cases in the past 2 weeks. If you remember, that was down from over 50 in previous weeks, and so that's great news. There is a decrease in the denominator as well. We've had weeks where we've had over 400 tests per week. I think people have stopped traveling for the holiday, at least for the time being, and so they're not coming in as much. But still, the denominator is significant to be able to tell us that our positivity rate here is about 10.7%. And in Colorado, it's much less, 6.29%. That magic number is 5%. So we're still far from that, but at least things are headed in the right direction. And then, of course, the favorite slide, no one has died of COVID-19 here in Lake County, which is awesome. The other good news is we got our second shipment of Moderna vaccine yesterday at the Public Health Department, and so we have another 100 doses. Emergency services are scheduled to be vaccinated, several of them today. Police, fire, public works, etc. They're going to get their vaccines this week. So we are well on the way of getting vaccinated 1A and 1B. And with just a few stragglers, all of 1A, so all of your healthcare workers have been vaccinated, those of us who wanted the vaccine, that's been done. And then hopefully this week, all of the emergency services, so all of phase 1, hopefully, at least the first vaccine, will be done here in Lake County over the next several days. And so over a 2-week period of time, we were able to get that done. It's all over the media this morning about how slow Americans have been in getting their vaccines out. And I think There's a couple things with that. I think one of the biggest challenges for us here locally in Lake County is actually getting the vaccines in our door. And so we have another call today with the state just to look at their distribution plans and how that will work. But please know that your medical professionals here are standing ready, syringes in our hands, ready to vaccinate anybody who walks in our doors. And so we're just waiting for the vaccine. I do not believe that distribution will be a problem here. I think that between St. Vincent Health, Rocky Mountain Family Practice, and the Public Health Department, will have ample people who will be able to vaccinate the public. So we're just waiting for the vaccine to arrive. And if we're fortunate enough to get the vaccine to arrive sooner than we anticipated, please know that we're not going to stay in the freezer. We will actually begin, vaccinating as quickly as we possibly can. So good news today.
Great. It is looking good.
Yep.
For the last report of the year.
Yeah, right. It will be a year that I will not be sad to see go. Anybody have questions for me today?
I do, Dr. Zwerdlinger. Are you getting any sense, or the health department getting any sense that there are people in our community who do not want to take the vaccine?
Yeah, there are some, and through all of the educational efforts that we've tried, there are very few. Most of the healthcare professionals have been vaccinated. There are a few holdouts, but most of us, a good percentage of us, I believe it's over 90%, have been vaccinated. And we don't know yet about emergency services, but from what I hear, through all of the educational opportunities that I've given them, the feedback has been great, and I don't think that there are many holdouts. The key, as we all know, with any vaccination is you have to get people to take it. And it doesn't matter if the vaccine is in the community, if it's not actually in people's arms, it doesn't help. And with this particular vaccination series, just by virtue of the way that it works, somewhere around 80%, maybe 80-85% of folks have to be vaccinated in order to get the herd immunity numbers that we need so that we can stop doing all of the social distancing and mask wearing and that sort of stuff. And so encouraging folks to take the vaccine so that we can have some semblance of normal is vitally important. So again, I offer my time. Happy to have any public presentations, individual conversations with folks to make that happen. And I do I've done the public information to all of the healthcare providers and the first responders, and then as soon as we know when we'll get the vaccinations for phase 2, I'll start rolling out more educational information for folks as well. But I'm happy to, I have a couple of speaking engagements, already arranged for the next several weeks with organizations, but please invite me. I'm happy to come.
Thank you.
The new, sorry, Greg, go ahead.
No, I'm done.
It's probably too early really to tell, Dr. Lisa, but the new variant of it that sprung up in the Great Britain and one in Colorado, supposedly, everybody seems to say that this vaccine is going to be effective with that too. So is that your take on it as well?
Yeah. So, the beauty of the Moderna vaccine and the Pfizer vaccine, honestly, is that it was designed to recognize the spike protein, which is common to all coronaviruses. And so it doesn't matter which coronavirus it'll recognize that spike protein. So, again, time will tell for sure. But it would make sense that if this new variant is a coronavirus, that this vaccine should work against that coronavirus as well. The thing that people need to remember is that viruses mutate all the time. And that's why we continue to get sick from them. Is that they have the ability to change the way that they look to the immune system. So it's a part of biology. It's what happens. But although this mutation makes the virus more contagious, so more likely to be transmitted between folks, it doesn't seem to change its virulence, and so it doesn't make people more sick than the other one did.
Okay, thank you.
Yep, and I would imagine that there are dozens, hundreds of variants of this coronavirus at this point, just because that's what biology does for us.
Okay, thank you.
Yes, ma'am.
When you take care of the healthcare workers and those pertinent folks. Who's next?
Yeah, so after first responders, and so if you looked at the Lake County Department of Public Health has a beautiful graphic about phase one, phase two, phase three, and so phase two, which is after all of the healthcare workers and the first responders are taken care of, are folks over 65, people with chronic medical conditions, and then other essential workers, grocery stores, the food chain people, that kind of stuff.
Okay.
And I think Beth just posted to the chat that summary for you. Thanks, Beth.
Okay. Very good. Well, thank you, Dr. Lisa. Any other questions for Dr. Lisa?
All right. Good morning, everyone.